Covenant Health is Canada's largest Catholic healthcare organization. We have 18 sites across the province of Alberta. We have approximately 10,000 employees, 3,000 volunteers, and roughly 1,000 physicians. Our business priorities are centered specifically on healthcare, with our main focus being on those vulnerable populations. So our seniors, end of life, and mental health and addictions, particularly in our rural areas. Part of our learning strategy at Covenant Health is to focus on more of a collaborative approach. So making sure that whenever it comes to best practice, that everybody in the organization, all employees in the organization, are able to have the same accessibility to learning, be able to not only have access to best practice, but be able to put that into daily practice in their work lives. Covenant Health is actually a very forward-thinking organization. We were in a situation where we went from zero to the cloud. Saba helped us to tap into resources that currently exist in our organization around expertise. And I like to think of it in terms of we have 15,000 experts in our organization. Now we're able to use this learning management system to create a workspace. Out of that, we've got videos that they've created. There's documents, even learning modules that are being built. So that can be shared across the organization. We're tapping into these experts that are in our own organizations, just even contributing to the body of knowledge around healthcare and best practice and policies in the organization. It helps us to really demonstrate collaboration, which is one of the values of our organization, and it's quite an exciting thing to see it happen. Saba enables us to bring together formal and informal learning. A lot of times in healthcare, learning happens through dialogue. Saba enables dialogue in a different way through our social pieces, so the discussion boards, the workspaces that we have. Blogging. Blogging has really taken off, and it's been one way that people can really showcase their own expertise. We have a nurse at one of our hospitals in Edmonton who has become an expert in wound care, to really tap into somebody who has expertise and contributing to the body of knowledge. That's someone that's in our organization at Covenant Health. So that is, that's exciting. And then that collaboration is just happening. And there's the trust that exists because we're all using the same system. And to be able to have those open, honest conversations in that sort of seemingly public environment at times really speaks volumes, and is one way that value of collaboration is lived and demonstrated in our organization. Saba has helped us to increase our employee engagement numbers just purely because there is more accessibility to e-learning. Saba has helped us with our accreditation through the ability to assign learning to our employees, track that learning, and being able to follow up with direct reports, to find out where, what learning has been completed, what has to be addressed. Saba has been very supportive, and even though we are experts in our field of adult education and instructional design and effective learning, we've had this great relationship that's been built through our contacts at Saba when it comes to support. The system seems to be malleable to us, and that any request we make to tweak it or to make it work for us at Covenant Health, it's always been a conversation around how we're going to make that happen, as opposed to a conversation around how it can't. So for us, it's Saba's solution-focused approach has been something that speaks to us at Covenant Health, because that's also our approach. Saba helps me to showcase the employee expertise that we have at Covenant Health and leverage it across the organization.